Now to the back-to-school season, which eventually coincides with cold and flu season and the vaccinations that could keep your kids healthy during the year. Joining us now is ABC News medical correspondent Dr. Darien Sutton to bring us up to date on all of this. Yes. All right, Dr. D, so tell us, because fewer and fewer kindergartners, they're actually getting these vaccines. They are recommended by the CDC, though. So what does this mean for public health?
That's absolutely right. The number of vaccination rates among children in kindergarten and in school this year and in the past 3 years have declined. If you compare, for example, the pre-pandemic period from 2018 to 2019, where we hovered just around 95%, we've dropped down just below 93%. That might not seem like a lot, but that equates to more than 280,000 children in kindergarten that are not up to date on their vaccination. Now, these numbers are not spread out generally across the United States. There are pocket communities that are very high risk, and that's what's driving the transmission. And as that number comes down, we see preventable diseases increase. The most contagious you would expect first. That's why we're seeing measles. Right now, we have the highest number than we've had since 1991, just over 2,700 cases. But it's not just measles. There are other preventable diseases like whooping cough, which has a high risk of hospitalizing young infants. So I think what's important for parents to understand is, number one, check your child's routine vaccine schedule. Make sure that they're up to date. If they aren't, talk to their pediatrician. And remember, exposure is almost inevitable to these types of things. Your question is, do you want to be exposed with immune protection or without? And that's what we use data for.
Okay, that's a very good point there. Okay, so let's talk about some of these other things that maybe we should be concerned about, specifically maybe COVID as we're heading back. We know rates are way down, but as kids head back to the classroom, they pick up every germ possible.
And classrooms are great places for that, right? You know, you have 30 or so kids in a classroom. That creates an environment where diseases can easily transfer from child to child. So COVID rates are down. We're still seeing positive tests. We were just talking during the break about how sometimes patients will come back with a positive test. It even surprises me for some reason, because in certain cases I'll see complications and in certain cases I won't. But what is important to understand is that there are guidelines out there. If you check the American Academy of Pediatrics, they produce guidelines to help prioritize those who are highest at risk. They recommend for children under the age of 2 to get their vaccination, and for children, teens, and adolescents who have a high risk, for example, an immune-compromising condition or asthma, or have a relative that has a high risk, to get their COVID-19 vaccine. All others, the risk of hospitalization is substantially low, but COVID vaccines still reduce your risk of an emergency room visit and an urgent care visit by more than 50%. Oh, wow. So in terms of saving time, illness, and money, it's really understandable to choose vaccines to provide that protection.
All right, Dr. Darien, back to school time.
Back to school time.
Thank you so much for that.